The governor of Edo State, Senator Okpebholo, has commended the members of the Nigerian American Nurses and Nursing Association for their contributions to primary healthcare delivery in the state as they paid a courtesy visit to the Edo State Government House in Benin City.
15 or 20.
Receiving the delegation alongside the Edo State Commissioner for Health, Dr. Cyril Adams Oshomole, and the Director General of the Edo State Diaspora Agency, Dr. Loretta Ogboroko, Governor Okpebholo gave the commendation to members of the association for their contributions to healthcare delivery in Edo State, praising the humanitarian call to action as he assured them of heightened security across the country following the government's sustained action to eradicate insecurity and make Nigeria safe for all.
I'm really very much grateful for what you are doing in the area of healthcare, especially the primary healthcare. Very big thank you to all of you. Thank you very much. And the hard-earned money that we are also spending to build the primary healthcare, just to provide healthcare for common people. What can I say other than say a very big thank you to you? Thank you very much. Nigeria is very sick. And we are also trying to make Edo safer. And it will be better in the next few months from now. Thank you very much, and I wish you all the best.
Speaking on behalf of the delegation, the board chairman of NANNA, Dr. Grace Ogeho Enoma, recounted the activities of the association in aiding and supporting primary healthcare across the state through health-centered contributions and initiatives geared towards providing healthcare delivery, as she expressed appreciation to the state government for its continuous support and hoped for further collaboration in improving the state's health sector.
I know that Dr. Adozu was talking about the 2 PACs, but we also have like the 7. I'm from Uwonde. We have 3 in Uwonde that we adopted. I adopted 2, and Mrs. Rofina adopted 1 in Uwonde. So we also have Igbehwe, that you didn't talk about the one you adopted. It's about Take Me to Your Village initiative. So we look at problems and provide solutions. So instead of complaining, the government is not doing this, the government is not doing that. If the PAC in my village is falling down, you have to do it. And that is what we said, Take Me to Your Village initiative, adopting the PAC. Also, education mission. We just completed 5 days leadership summit, for our nurses. We want Edo nurses to be the best in the world. Yes, right now, these nurses we have here, anywhere in America, we are proud to be Edo nurses, that we are from Edo. So competency is very important, so that when the patients come to our facility, they are safe. And instead of, you're going to travel abroad, we say, here in Edo, come to Edo and receive your care. And that is why competency is very, very important, that the nurses will be trained. So we have those 5 days workshop. We're also providing scholarship to nurse educators. One of the problems we identified was that to train more nurses, you need educators. And the complaint we're getting from Nursing and Midwifery Council was that the nurses are not going back. We said, we're going to pay their tuition for the year. It's a 1-year program. We pay the tuition, we pay for their books, and then they go for the program. We've done 70 nurse educators right now. And also, colleges of nursing also reached out that they were having issues with computer-based testing that they do, that they needed more computers. We did the assessment. We don't just want to give you computer. We said we're going to develop a standard ICT center. So UBTH alumni is a chapter of NANNA. So right now when we leave here, we're going to UBTH because we've started the ICT to give them 250 computers. But they have to have the Wi-Fi and they have to have the solar to monitor, so they can do their JAM and they do all these exams, there. So it's another program we're doing. One special one that is dear to my heart is that if you are sick and you are in the critical care unit, we didn't have the training to train our nurses, standard training. They only have 4 programs in Nigeria. They were all in the north. So for us, we said, our people can't be going to the north. Why can't we have it in the south? So the first critical care program, nursing critical care program in the south is at UBTH. So we're able to facilitate that. Because for what we do is, how do we gap the difference? So it's no longer Jakba, we are saying Jakbada. So we are coming back, like you talk about the Shine agenda, the H, that health, whatever the government is doing, we want to support and help strengthen that.
Olumide Abiodun Mudashiru reporting for PFM Global News.